Hello, dear learner. You are welcome to this program on health issues, healthcare, and system and strategies. So, before coming to healthcare system and strategies, I would like to give the program under which this course and content is a part. This course MADVS is full form Development Studies. MA Development Studies is a very popular program and interdisciplinary program. It is not like earlier one traditional discipline, rather many disciplines are crisscross or very nicely designed program, and it covers almost 72 credit. I don't know how many of you will understand the credit value, but 72 credit, that means academic load has given in this program. This almost there is 15 courses and lots of choices given there. This is a very significant component and subject. Most of the good institutions offer these kind of development studies like IIT, NIT, and London School of Economics. Many institutes offer this development studies. So it has much demand, particularly 2020 new education policy, which focus on the issues of interdisciplinary and multidisciplinary approach. So it has covered almost 6 credit in the first year. First is the introduction to development and development theories. Theories are less, more of applied component is there. Dynamics of development. What are the changes in development scenario going on from today, earlier, that means past and present. Development scene has discussed in this course. Third is the MDB 103, issues and challenges of development. Issues and challenges, a very pertinent, important course which has also other discipline like economics, and this course has offered by other discipline also. Research methodology, like every discipline you will find in social science, research method and methodology. Without that, it is incomplete, particularly the field study and any research component. Next is the development of India. Before this, we talk about development in general, not specific to India. Now, this course focused on development in India, how development is taking place in India and overall pre-independence and post-independence, different sectors like agriculture, industry, transportation, everything has covered within this course. Next is the MDV4, gender and development. See, nowadays women and female folk is struggling for their right. And this course is focused on gender issue, how gender is perceived, how it should be taken, and also the dynamics of gender has discussed at length. So all these 6 courses in first year will give you a very good knowledge about development studies. Next is second year. The beauty of second year is there is 8 courses and 1 applied project work, and you have to choose only 6. That means 6 courses you can opt, or you can opt 4 course plus 1 project work. Project work will give you a very good idea about the field study, whatever you studied in research methodology, that you can apply in the field, and very good dissertation will come up after your work. So, under your supervision, I mean any supervisor. So, all these 8 courses are like, briefly I'm just illustrating MDV 105, development planning and management. Second is development communication and extension. Nowadays, development communication is coming up a very important role. So, this course is also opted by other program offered like journalism. And next is training and development. Without training, development is incomplete. So each level training is given, whether it is a professional courses, whether it is a research program, whether it is a paramedical programs, teacher training program. Training is essential, and that is very important and gives you a very length information about training and the role of development. Next is a fourth course is offered on local self-governance and development. Some of you must be aware that local self-governance is one important component of governance. How local governance is going on and how it can strengthen. So many administrator has opted also this program to learn and strengthen their administration. So this is a very important way this course has designed. Next is the health and development. Health and development, issue of health is so important, everybody knows. Today, after few minutes, we will start on this course detailed analysis, health and development, and it is almost 5 broad sections, 20 subsections, very nicely designed. This family health care and strategy is within this only one section we will discuss at length. Introduction to development. This development studies encompasses both rural and urban areas, and 2 courses has inducted. One is urban development and other is rural development. Both this course will give you very good idea about the trends of rural development and urban development. Urban area is growing day by day. Due to migration, people are migrating from rural to urban, and increasing trend, almost 3/4 populations are only living in rural area, roughly 70%. So urban area is increasing population and trend needs to study, and urban infrastructure also, urban transport also, all these things discussed in urban development. Related to that, 2 courses, one urban issue and challenges, planning and development, and rural development in Indian context, as I have already mentioned. So therefore, this is very important. Now I am coming to health system and strategy. This has 4 components, and 4 components include primary healthcare delivery system, that means health from community, village to the national level, how it has structured and made it mandatory. So various components you will see within this section also. Second is civil society and healthcare. Civil society, I mean those sections other than the government and private initiatives like state initiative and third sector. First sector is government, second sector is business or capitalist, and third sector is civil society. This third, behavioral changes, communication in health care. BCC is a very important component in health. So, and last is intersectoral coordination in healthcare. Last two units we will discuss later on, but today we will discuss about the primary health care. Primary health services are delivered through chain of healthcare delivery system in each country, from national, state, regional, district, sub-district and community level. In 1978, World Level Conference in Alma-Ata in Kazakhstan considered primary health care as the key approach to ensure health for all, and popularly known as Alma-Ata Declaration. This is a global commitment for community-driven and quality health care. Both physical financial guidance by to WHO, World Health Organization. PHC, primary health care, has been created in community-wise each village, and that is the major task of not only the equitable distribution of health services, but also community participation to achieving the primary health care objectives. Health, manpower, delivery, development of PSC also given importance. So, use of appropriate technology. Healthcare system changing time, they also use different technology and play a very important role in health services, and that is the purpose of primary health care system, which has created in different villages, panchayat, district and all above levels, and huge amount has dedicated financed for that. For this, a multi-sectoral, both inter and intra-sectoral coordination for goal of primary health care. See, inter and intra-sectoral coordination, one of the important strategies for any program, whether it is related to health, whether it is related to education or any other. So, this we will discuss later on, but I am coming why the necessity of this primary health care developed, because the huge loss due to health, sickness and other issues, high cost of health technology, inadequacy of health services coverage, new approach forced to come up. So, primary health care offered rational, practical means for both developing and industrialized nation to work towards health for all. That means health is not anyone's particular, it became a right, almost right, that everybody should be given the health facility. So essential health care, it has also the component of few immunization program, and very nicely it has supported by PHC. Delivery, pregnant women should be given support. So PHC has inducted their role, and maternal mortality has come down, drastically come down. This is the most important thing. Many immunization programs, health education, and maternal mortality issues really has addressed, and it has shown a drastic change at the level of PSC, because some essential components I would like to mention here. The primary health care in Alma Ata Declaration in 1978, later on in 2018. After 40 years, again this declaration, people of the world sat in Alma Ata and they stated that the primary health care should have at least the following 8 component essential: education for people about prevailing health problems, method of preventing and controlling them. That means first is the health education has focused in this strategy. Second, promotion of food supply and proper nutrition. In large sectional people don't get proper, adequate, nutritious food. So second thrust is proper, adequate, nutritious food. Provision of essential drugs. Many essential important drugs are not available, so it has made mandatory through PSC, it must be provided all the people across their belongingness, both male and female. Maternal and child health care and family planning. It has drastically changed that maternal and child health care, improved maternal mortality, as I have stated earlier, immunization against major infectious disease, prevention and control of locally endemic disease, and last and most important is appropriate treatment of common disease and injuries. At the village level, this kind of institution has created a support, a sense of belongingness or health. So this has played a very important drastic result. It has shown after 2018 result has proved, and I would like to say in health these 8 components played a very important role. And therefore, development studies, this course, not only part of development study, health and development, rather many other programs like corporate social responsibility, population and health, and other programs offered this course. So I will suggest you can opt this program, development studies. All the courses are important, as I mentioned there. Thank you for today's program. We will meet next session on the intersectoral coordination and BCC, how this functions for health. Thanks.
Hello learners, are